Let me tell you about the night Jennifer found out her insurance was basically useless. She'd been paying for a decent health plan through her employer for years. $340 a month out of her paycheck, gone before she even saw it. Not the cheapest plan, not the most expensive. The kind of plan most people would call responsible. Then her son broke his arm, falling off a trampoline on a random Tuesday evening. They went to the ear. The doctors did what doctors do. X-rays, a reduction, cast, a follow-up visit. Routine stuff, honestly. Nothing exotic. A few weeks later, the bill arrived. $7,400. Jennifer stared at it, confused, because she had insurance. Good insurance, she thought. Then she saw the line that explained everything. Applied to deductible. $6,000. Her plan had a $6,000 deductible, and she hadn't hit it yet that year. Insurance was going to cover almost nothing until she'd already paid thousands out of her own pocket. First, she had insurance. She was still financially crushed by a broken arm. If you've ever looked at a medical bill after being told you're covered and felt genuinely confused about what you were even paying for all those years, this video is going to explain exactly what's happening and why it's not an accident. My name is Bobby, and I spend way too much time thinking about the systems that are quietly designed to look like protection while functioning very differently in practice. If you're someone who pays for health insurance every month and still feels one bad diagnosis away from financial ruin, make sure to hit that subscribe button and give this video a thumbs up if this helps you out. Here's the uncomfortable truth. Having health insurance and being financially protected from a health crisis are two completely different things in America, and the gap between them is where millions of families quietly go broke every single year. Let's start with the numbers, because they tell the real story. According to a widely cited study published in the American Journal of Public Health, medical debt is a contributing factor in a majority of personal bankruptcies filed in the United States, not lack of insurance. Medical debt among people who often had insurance at the time. Let that sink in for a second. Having a health plan is not the same as being protected from the financial consequences of getting sick. So how does this actually happen? It comes down to three words that live in the fine print of nearly every plan: deductible, coinsurance, and out-of-pocket maximum. Most people can barely define these terms, and insurance companies count on that. The deductible is the amount you pay entirely out of your own pocket before insurance contributes anything meaningful. According to CF, the average annual deductible for employer-sponsored family coverage now sits well above $3,000, and for individual marketplace plans, it can be significantly higher, sometimes $7,000, $8,000, or more for a single person on a bronze tier plan. That means before insurance pays $1 toward most non-preventive care, you're expected to cover thousands of dollars yourself. Then, even after you hit your deductible, you're often not fully covered. That's where coinsurance comes in. A typical plan might cover 80% of costs after the deductible, leaving you responsible for the remaining 20%. On a $30,000 surgery, that 20% is $6,000 on top of the deductible you already paid. Finally, there's the out-of-pocket maximum, the absolute ceiling on what you'll pay in a year. In theory, sounds protective, right? Except that ceiling, for many plans, sits between $8,000 and $9,000 for an individual, and can be close to $18,000 for a family, under current federal limits, meaning a single serious health event, a surgery, a hospitalization, a cancer diagnosis, can legally cost you close to $18,000 out of pocket, even with what most people would consider good insurance, before your coverage kicks in fully. Let's run real numbers on Jennifer's situation to make this concrete. Her plan has a $6,000 deductible and 80/20ths coinsurance up to a $9,000 out-of-pocket max. Her son's total bill comes to $7,400. The first $6,000 is entirely hers. That leaves $1,400 remaining, and she owes 20% of that, which is $280. Total out-of-pocket cost for a broken arm, $6,000 $2,280 for a family that budgets carefully. That's not a manageable inconvenience. That's a financial emergency, potentially a credit card balance that takes over a year to pay off. Potentially the exact kind of unexpected expense that we've talked about before on this channel, the kind that turns a stable household into a fragile one overnight. And here's the part that really gets me. Jennifer did everything right. She had a job with benefits. She chose a mid-tier plan, not the cheapest option available. She paid her premium every single month for years, without ever filing a major claim. She was, by every conventional measure, financially responsible, and one broken arm still cost her more than most Americans have in savings. According to Federal Reserve data, a significant share of American adults couldn't cover a $2,000 emergency expense without borrowing. A single accident can blow past that instantly, insurance or not. This is the trap. We're taught that having insurance equals being protected, but insurance, structurally, is designed primarily to protect you from catastrophic, worst-case scenario costs, the kind that would bankrupt you many times over, like a $500,000 cancer treatment or a long hospital stay. It is not designed to make routine, unexpected medical events, the broken arm, the appendix removal, the visit for chest pain that turns out to be nothing, financially painless. Those fall squarely into the deductible and coinsurance zone, the zone where you're paying nearly full price while still holding an insurance card in your wallet. Now, you might be thinking, Bob, isn't this just how insurance works? Isn't some cost sharing normal? And you're right, to a point. Cost sharing exists in every insurance system to reduce unnecessary usage. The issue isn't that cost sharing exists. The issue is how large it's become in America, specifically, and how poorly understood it is by the people paying for it every month. Many Americans select a health plan once a year during open enrollment, glance at the monthly premium, pick the plan that fits their paycheck, and never actually run the math on what a real medical event would cost them under that plan-specific deductible and out-of-pocket structure. So what can you actually do with this information? First, when you're choosing a plan, don't just look at the premium. Calculate your realistic worst-case exposure, deductible plus your share of coinsurance up to the out-of-pocket max. That number, the monthly premium, tells you your true financial risk for the year. Second, build a dedicated medical emergency fund. Separate from your general emergency fund if possible. Size to at least cover your plan's deductible. If your deductible is $6,000, that's your target number, sitting in a high-yield savings account, untouched, specifically earmarked. For the moment, your family needs an visit or an unexpected diagnosis. Third, if your employer offers a health savings account alongside a high-deductible plan, understand that SHA contributions are triple tax-advantaged. Tax-deductible going in, tax-free growth, and tax-free withdrawals for medical expenses. It's one of the few tools specifically designed to soften this exact gap, and most people who have access to one aren't using it aggressively enough. Here's the mindset shift I want you to leave with. Insurance is not a force field. It's a cost-sharing agreement with very specific rules that most people never read closely until they're standing in an at 11 at night. Understanding your deductible and out-of-pocket maximum before you need them is not paranoid. It's the same principle we've talked about before, building margin before the crisis hits, not scrambling to find it during one. The families who handle a medical emergency without it becoming a financial catastrophe aren't the ones with the fanciest insurance plan. They're the ones who actually understood what their plan covered, calculated their real exposure in advance, and built a specific cushion for that exact number. Insurance reduces your risk. It does not eliminate it. And the difference between those two words is exactly where medical debt quietly destroys American households every single year. If this video changed how you think about your health insurance plan, make sure to smash that like button and subscribe for more content that challenges how you think about money.